My name's Daniel Ray. I'm Director of Informatics and Patient Administration here at UHB.
My name is Sajan Khosla. I'm Principal Clinical Informatician at UHB.
And today we're going to talk to you about two things related to the white paper. So the first is equality outcomes. That's something that UHB has been looking at for a couple of years now. On the 1st of September 2008, we developed a quality outcomes research unit here at the Trust. Over the last couple of years we've been developing quality metrics with our clinicians, and from the informatics side pulling data out of about 12 to sort of 15 different information systems, and then linking all of that data together to provide the clinicians with quality metrics that they feel represent excellent delivery of care in their specialties. So I'm just on the home page now that you can see here, www.uhb.nhs.uk, and there's a tab across the top here called Quality. So if I scroll down here, you can see the Quality and Outcomes Research Unit. If I just click on this, it would take you through to more information about that particular unit. And then these are all the metrics in the different stages. So if I click on acute medicine, for example, these are the consultant leads, the specialty that it relates to, the CORU lead, and then what the individual metric is. And again, you can click on here to drill through to them. So that can be accessed by anybody within the Trust. We've also got this web page where you can pick your specialty, and it will then show you all of the quality indicators that have been selected for the specialties that have been picked. And here you can see what the performance is that relates to it. Some year-to-date figures, lots and lots of different indicators that we've got here that have all been developed by our clinicians that all relate to quality and outcomes. So we're going to start to focus on that much more so, and rather than being an internal tool historically looking at performance, obviously with the white paper that's going to start to play a role externally as well. The other important thing as well that we mentioned was around understanding where our patients are coming from. And on the GP side is making sure that our GPs are given and we provide them with all of the information that they need. So we're currently reviewing that as well, and making sure that they've got the very latest information that they need. So I'm going to hand you over to Sarge, who's going to mention a couple of words about it and then take you over and show you that tool. Sarge.
So as Daniel mentioned, with the work that's been done with CORU, this is really driven by our clinicians. So our clinicians are always quite interested in to see how their activity is being represented towards their GPs, and where that patient activity is actually coming from as well. So what we have here is a heat map distribution of where all the patient activity for this hospital is coming from, and you can hover over distinct areas and then select the area, and then even select different age groups and different types of activity that's coming from these different areas. So I can select, based upon HRG, the different types of activity coming into the Trust and what type of admission that is. If we were to look in a bit more detail as to how that activity has changed based upon the practice, it'll go away and then map out all that activity into different trusts, and then those trusts will be mapped out as distinct lines of activity and then shared over time. So this really allows our clinicians to engage and contribute into discussions with the GP practices surrounding the Trust, and really get to grips with how we can better the type of activity that we're providing towards these GP practices.
So we hope that that's given you an insight into a couple of areas that we've been working on. One quite recently in the response to the white paper